Hi, my name is Kevin. I'm in training to become an EMT, and today I'm going to be demonstrating a trauma assessment, a full body scan in the trauma assessment. I will first start by palpating the patient's head, and as I do this, I'm looking for any signs of CSF coming out of the nose or the ears of my patient. After that, I will be looking behind the ears for any indications of vital signs, which may indicate a injury to the skull. Also, I will be looking at the eyes, seeing if they resemble any raccoon eyes. But that would also indicate a fracture to the skull. Next, I will be simulating the pearl onto the pupils, seeing if there's any neurological damage to the brain. Here I'm looking for equality, roundness, and the reaction to light. After I am done palpating the head and assessing the head, I will then move down to the rest of the body. Throughout the assessment, I'm looking for DCAP BTLS. And DCAP BTLS stands for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling. At the end of the DCAP BTLS, there's also IC, which would stand for instability and crepitus. So as I assess the arms, I do so by doing this. And my main focus is instability as well as any deformities, which would indicate a fractured bone. Next, I would assess the chest. And as I assess the chest, my main focus is DCAP BTLS as well as bilateral movement of the chest. I'm mainly looking for adequate chest rise and fall, adequate tidal volume. So as I do that, assessing for DCAP BTLS. Okay. Next, I will then assess the abdomen, and in the abdomen I would be looking for any guarding, pulsating masses, any rigidity or tenderness. Next, I will be assessing the pelvis, and the main focus here is instability. So, and then this instability. Next, I'll move on to the legs. Same thing with the legs as well as the arms. Main focus is instability or deformities, maybe indications of a skull, of a bone fracture. Now onto the feet. And as I move on to the feet, I will be assessing the pulse, making sure there's adequate circulation throughout the patient's body. And in the pulse, I'll be looking at the dorsalis pedis pulse, which is located right here in this area. Now, if I can't find the pulse in this area, I would then move on to the post tibial, which is found right here into the patient. After I take the patient's pulse, I will then assess the motor skills of the patient. Can you please wiggle your toes? Both? Okay. Now, since your eyes are closed, which toe am I touching?
Big toe.
Okay. Now, same thing with the hand. I will be checking the radial pulse. After I assess the radial pulse, please wiggle your fingers, both hands, please. After that, I will be checking motor skills. What finger am I touching?
Index.
Okay. Lastly, on my patient, I will be assessing the back. And on the back, I'm looking for any discoloration that may indicate bruising, or that may appear as bruising. I'm sorry. And this would mean blood pooling, which is a very serious indication of either death or serious injury. And after I'm done assessing that, gently move my patient back, and after that, my patient will be ready for rapid transport. And this concludes the rapid body scan and trauma assessment. Thank you.